You were a vocal proponent of including a public option in the health care bill that cleared the House earlier this fall. It looks like the Senate has taken the public option completely off the table. What is your opinion about the health care package that's taking shape right now? Is this a deal breaker for you?
I am concerned about the direction of the Senate bill because I think one of the core principles laid out by the president and set out by this Congress is, affordability, quality, and coverage. And I think that, we don't want to be in the position where the federal government could simply sit and write a check and turn it over to the insurance companies while they continue to raise rates. So I'm concerned about the Senate bill. I think that there are some things to really commend in the Senate bill, and I'm looking forward to a vigorous and a real conference of the House and the Senate bill because, there's some elements also of the House bill, including the public option, that I think are important to comprehensive reform.
You're basically saying that you're hoping and thinking that the public option could get back in conference.
Well, I think there's a lot of support in the House of Representatives for the public option, and frankly, there's majority support among Democrats in the Senate for a public option. And
just
so I want
60.
to see us. That's right. I want to see us, though, get to a real conference where we can pull these two bills together and come forward with something that really makes sense for the American people, and recognize that just like Medicare 44 years ago, what you pass on January 1st isn't what you end up 44 years later with. And so I want to get us to a point where we continue to reform the system so that it provides comprehensive coverage, quality care, and it's affordable for the American people.
Congresswoman Donna Edwards talking about the issues until we can lure her into the conversation about the Glen Ivy challenge. But Tom Sherwood, go ahead, please.
Well, can we just go right to that immediately? But it does sound like to me that the health care bill, there may be I don't want to say stripped down because that sounds like too much is taken out, but a more streamlined health care bill may pass with some other issues to be fought down the road. Do the Democrats have to get something?
Well, I think it's important to us. The president made a commitment for health care reform when he campaigned. Many of us, and I know that I did, made a commitment to stay focused on health care reform for the people of the 4th Congressional District. And this is an imperative. It's an economic imperative for us, and it's also an imperative for 97,000 Marylanders who don't have health insurance.